Hello. Today I want to speak to you about a very important issue, probably an issue that's even more important given COVID and the pandemic that we're facing. I want to talk to you about what it means to have healthy lungs. Now, our lungs are one of those things we just don't think about. But the truth of the matter is lung cancer continues to kill too many people in this country. Actually, 85% of the people who die from lung cancer in this country die because of their tobacco use. So during Lung Cancer Awareness Month, I want to spend some time talking to you about what Inspira has done to provide assistance to work with you during this difficult pandemic time, but also on this very important issue. Here at Inspira, we've created the Inspira Quit Center that allows us to partner with you if you are a smoker. My dad is 91 years old, and he smoked probably from the time he was a kid till in his mid-50s. And he didn't just smoke. He smoked a pipe, he smoked a cigar, he smoked Pall Malls. If you can remember what those are, they had filterless cigarettes. So he got the whole dose of it. And when I was about 13 years old and had studied the first time in school about the damages that can happen with tobacco, he made me a promise that he would quit. And he never smoked again. The people who need to be screened are people who are between ages 55 and 77. Even if they have no symptoms. But if you've been a smoker that smokes every day, a pack a day, that puts you at a high risk category. Even if you've quit, it's still important to come in for the screening. And we have invested in Inspira in both talent and equipment that will be able to assist you if indeed you do end up with a diagnosis. Our talent is Dr. Charles Shea, and he brings with him a whole host of expertise. So much so that we actually purchased a special piece of equipment that works like a GPS unit. It goes in and it finds exactly where that lung cancer is, and Dr. Shea can eradicate that. But the only way that Dr. Shea can help those folks who may be facing lung cancer is if you get screened. So I'm asking you today to please take time during October, come in, get the screening you need, and then allow us to partner with you. The other things that we've been doing at Inspira is really looking for opportunities to extend ourselves in every way we possibly can. And one of those opportunities came when we answered the call from Joe McGurk of Glendora. See, Joe has had 72 hospitalizations. He has diabetes, he has GI issues, he has all sorts of things that cause a chronic health condition. But Joe had something very important going on in his life, his son's wedding. And 2 weeks before his son's wedding, after 72 hospitalizations in lots of other different facilities, never an Inspira facility, he called when he couldn't get in for an infusion that he knew he absolutely needed to be able to be at his son's wedding. And just that day, one of our nurses picked up the phone. She heard the plea in Joe's voice, and she said, "We're going to make a difference here." And we did. Joe came in for that transfusion that was so important. And 2 weeks later, he was at his son's wedding. And what Joe said is, "Well, I've never been to Inspira before. They earned my trust that day." And that's the difference. You can have all the equipment and all the fancy buildings, but it's about the people that partner with members of our community to make sure they get access to the healthcare services they need. So as I am closing today, I'm going to ask you, if indeed you're a candidate for lung screening, please come in and get that screening. And if you've never used Inspira before, and you'll give us a shot, we'll do our best to make sure we earn that trust, just like we did with Joe's. So I end my comments today as I always do. Thank you for allowing us to partner with you to care for you. Be safe and stay well.